Pumice is volcanic sand. It's extremely abrasive. There have been all sorts of studies that show that it scratches natural teeth and restorations. Pumice can damage enamel up to 12 microns, but because dentin is so much softer, pumice will damage up to 50 times more dentin. On composite, it scratches it so that there's more area for stain and biofilm to adhere to. It will scratch and dull porcelain. It'll scratch the veneers. And right now, the only alternatives for a hygienist is to either do nothing on some of these surfaces, or to fool the patient with toothpaste, or they'll scratch it with pumice. It's been around forever. Cavemen used to get a little bit of volcanic sand and use it as toothpaste with a little bit of water. Because of the damage that pumice is known to cause, the schools now teach what they call selective polishing. Now, what selective polishing says is that the hygienist shouldn't just go into every mouth and polish every surface because pumice is so damaging. What they recommend is that the hygienist should only polish those very badly damaged teeth and leave everything else alone, and only use fine pumice. Well, that just doesn't happen in the real world. In the real world, the hygienists are using coarse pumice on everything and really destroying miles of smiles in the process. CPR is a 1 micron sapphire-based formula, and it does not abrade. You can use it on composites, you can use it on veneers, use it on porcelain, and it will remove up to 4 shades of stain on composites. Gordon Christensen, in his newsletter, found that CPR was an outstanding product of the year. The reason for that is because unlike pumice, which scratches everything and shouldn't really be used at all, CPR smooths out the surface, works as fast as coarse pumice prophy paste, but with none of the damage. And the 1 micron formula actually makes the surface so smooth that it's much more difficult for biofilm to adhere to. It's very, very versatile, so you can use it as a mixed mouth, full mouth prophy paste on a routine basis, and to be used as a final step after placement of veneers, porcelain, and composites. Even after bleaching, it's great to smooth the surface so it's less apt for future staining. The only drawback of CPR, if there was one, is it's 50 cents more per cup. Now, if you really look at the damage that pumice is causing, 50 cents is a very, very small price to pay to be used in routine prophylaxis. Rock is pumice, sand is cheap. CPR is a sapphire formula, which obviously is much more expensive than cheap sand. CPR has a very pleasant mint flavor, and it's smooth on the teeth. It's very nice against your teeth, on your teeth. You don't have that, you want to spit it out, sand in the mouth feel. I think one of the most important things are patients are paying a lot of money for their cosmetic restorations, for their dentist to take care of their teeth. And here's the hygienist, which most hygienists are using coarse prophy paste on all surfaces. And without the patient knowing it, they're creating a lot of damage. It's not fair to the patient, it's not good for the practice. So CPR is something that the hygienist can do in good conscience, knowing that they're using the very best product, taking the very best care of the teeth, get the details done so when people smile, they are their very best. And CPR is something that can make their smile as beautiful as possible, as biofilm resistant as possible, so you don't have to feel guilty. I wouldn't let pumice into my mouth. I don't want that sandy stuff in my mouth damaging my teeth and my restorations. For only 50 cents more per cup, CPR is an excellent investment into your patient's smiles, as opposed to using pumice and continuing to destroy miles of smiles. CPR, Sapphire Prophy Paste, safe for every surface, every smile, every time.